Good afternoon, and this is in a beautiful Sunday morning um, or noon. I want to give some important lecture on a very important issue of our today's life. That is hypertension, or generally we call it high blood pressure. And why it is important today in today's life? Because with the modification of technology, we have our life different or bizarre from the normal ones, which we used to live once upon a time. And that have led to major lifestyle modifications, and thereby it has turned risk to the lives by adding hypertension, diabetes, kidney diseases, like those problems. Now, the problem is, why should we understand hypertension and why should we treat it optimally? Because hypertension or high blood pressure per se is not the problem, but the problem is whenever it is there, it is going to create a problem on your vital organs like the heart, the kidney, and the brain, and the eyes. And eventually, you get stroke of these areas. We have heard, we have seen so many instances in our family members that they are either attacked with acute myocardial infarction or heart attack or the brain stroke in acute times or in chronic times. If you do not treat hypertension or high blood pressure, then you land up in chronic kidney diseases or the heart ailment, because the system is definitely going to crash one day if you lead a life with hypertension. So the thing is, now understanding hypertension is like basically each time with heartbeats, it pumps the blood into the blood vessels. And this blood vessel, when it is pumped, there is a normal pressure for that, and that is called blood pressure. Now, in a normally healthy person, it rises and falls throughout a day. But when the blood pressure remains high for a longer time and untreated, and that's why these problems happens, which is hypertension. High blood pressure usually develops over time, not in one day, and because of this regular physical, and because of not having regular physical activity and obesity, smoking, high alcohol consumption, and stress, these lead to hypertension, as I told. So there are other risk factors which I'm going to discuss with you, because those are treatable causes. And the first thing is, which we cannot modify, is the age. As people get older, the arteries are stiffened up and become narrow, and that due to excessive fat within the artery is deposited. Second is the family history of high blood pressure. One or more close family members with hypertension, that definitely increases the personal risk to develop this condition. And if it is from both the parents, then you ought to get it earlier than what it is expected in your parents. Then excessive salt intake, that is very important, that raises the blood pressure. And not eating enough foods with potassium can increase the blood pressure and the risk of stroke and the kidney disease. Eating processed and fatty foods which are increased in fats, that also increases fat within your body and make the heart work harder to push the blood throughout the body, hence causing the blood pressure to rise. On the other hand, lack of physical activity also is linked to the obesity and further to the high blood pressure. Another one is stress, that we do not see or we do overlook it. With different lifestyles, we are now stressed within this 21st century. Every people, and especially from the childhood days, they are also stressed, which lead to development of hypertension in an earlier age than what expected in our previous generations. So that is also reacting to stress in an unhealthy way or not managing stress can lead to increased blood pressure. So moving on, hypertension does not have any obvious signs and symptoms. That is why it's often called as a silent killer. So it puts people at risk for several diseases, from cardiovascular problems to kidney disease, stroke, and even damage to blindness, as I said. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether persons have high blood pressure or not. So generally, when symptoms do occur, they include morning headache or tiredness, vision changes, buzzing in the ears, nausea or vomiting, fatigue. And if person is experiencing some of this kind of symptoms, one should get blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now, let's try and understand what do these numbers actually mean. A healthy or normal blood pressure should have a number of 120 by 80 millimeter of mercury, and it can be read as 120 over 80 millimeter of mercury. Here, the upper number indicates the systolic blood pressure, and that means when the blood vessels contract, blood vessels are dilated with when the blood heart is contract. Here, the upper number indicates the systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates the diastolic blood pressure, means the pressure in the blood vessels when the heart is at rest and in between the beats. If blood pressure is more than 140 by 90 millimeter of mercury, it is called hypertension, and definitely the number has been reduced to a again stringent number to 130 by 90 in today's world. That means you have to keep your normal blood pressure below 130 millimeter of mercury in the systolic and below 90 millimeter of mercury in the diastolic range. The risk can be prevented by reducing the steps for healthier lifestyles. Which are those? Like number one is regular exercise, healthy diet, quit smoking, reducing your alcohol intake. Regular blood pressure monitoring is a key to this problem, stress management, and definitely the last one is adherence to the medicine whenever it is required. If blood pressure is successfully controlled with such lifestyle modifications, then it definitely will be avoided, delayed, or reducing the need for medication. So let's look at these strategies. Number one, regular exercise and physical activity. Exercise can be a drug-free approach to a lowering of blood pressure. So regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessels will decrease and lowers the blood pressure. In another case, as we all are aware that age and weight gain are the two major risk factors for high blood pressure. So if the blood pressure is at a desirable level, that is within 120 by 80 millimeter of mercury, then exercise can help prevent it from rising as you age. So regular exercise also helps you maintaining a healthy weight, which is, in my opinion, is an important way to control the blood pressure. One should aim for at least 30 minutes of aerobic activity most of the week. We call it, if it is better if you can go for 1 hour and at least 5 days a week. High BP level can be reduced by doing regular structured exercise, such as brisk walking, jogging, or swimming, as a person can do at their level best. Second one is the healthy diet. Diet also plays an important role in controlling blood pressure. A healthy diet with a high intake of vegetables, fruits, whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as DASH diet, or it is called Mediterranean diet, eating less supersaturated fat and total fat, getting plenty of potassium as it is found in beans, kismis, or grapes, sweet potatoes, like these things. And it is best found in the coconut water or in the uh, different fruits. As you have to take it, you can definitely prevent your hypertension. Limiting the amount of sodium in the diet at the same time, and limiting alcohol consumption. What is this DASH diet means? DASH diet, that is definitely has anti-hypertensive diet. Eating a DASH diet that is rich in whole grains, fruits and vegetables, and low-fat dairy products, and skims on supernaturated fats and cholesterol can lower one's blood pressure by up to 11 millimeter of mercury, having high blood pressure. Reducing sodium intake in your diet. So even a small reduction in the sodium in the diet can improve your heart health and reduce blood pressure by about 5 to 6 millimeter of mercury. And if you want to decrease your sodium level, then you can consider the tips like read food labels. If possible, choose low sodium alternatives of the foods and beverage you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in the foods. So most sodium is added during the processing to preserve it, and that causes it is a hypertension. So you can eat natural products. Don't add salt. Just one level teaspoon of salt has 2,300 milligram of sodium. So avoid adding salt to food. Use herbs or spices instead to flavor your food. Quit smoking is another key to this level. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health, because it reduces the atherosclerosis or the stiffening of the blood vessels to happen, and that's why it is important. Fourth one is regular blood pressure monitoring. Some of hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressures. Hence, most often I advise patients for self-monitoring measurement of blood pressures at office or in home. That is most suitable. So definitely you buy a sphygmomanometer or a digital machine that would help you better and check regularly. And you can measure it at different times throughout the day and over a longer period of time. And it also definitely gives better prediction of cardiovascular morbidity and mortality rather than a single approach to a doctor once in a month or once in a three months routine. So it would be definitely better if you can measure your blood pressure after waking up in the morning before taking the medicine, and 3 to 4 hours after taking the medicine, and in the evening once again, and so that you can know what is your early morning blood pressure rate is getting controlled or not, because it is the time when the maximum catastrophes happen, like the strokes, brain strokes. So reducing the morning blood pressure will be our most important thing, and whether your blood pressure is reduced or not by taking medicine, that is also needed. And that's why after 3 to 4 hours of taking medicine and in the evening, it is measured. Number 5 is the stress management. By learning how to relax and managing stress can improve your emotional and physical health and lowers blood pressure. Stress management techniques included are exercise, listening to music, focusing on something calm and peaceful, and the final one is the meditation. Meditation, this is definitely you can learn from different meditation schools or areas where there is a scientific approach to the meditation. And I am going to give you suggestion for art of living to take care of yourself, and you can enroll for that. And that is a superb uh, meditation center, and you can relax yourself once you are added in those programs. And adherence to medicine is the last one, because whenever you have developed blood pressure, you can do your reduction of alcohol, sodium, smoking, modifications of your foods, and following that, even if the pressure is not getting control, you have to go for medicine. So a medicine to lower blood pressure is recommended by a doctor. If your blood pressure is consistently high, definitely you have to take this medicine. And at last, I would like to suggest that there is nothing more precious than having a fit and healthy body and life. Adapting healthy lifestyle can help us to enjoy a long and healthy life, and high blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain the normal blood pressure at regular intervals and with regular monitoring of the blood pressure and preventive care. Have a healthy life.